Well, degenerative disc disease is obviously very common. You hear about it frequently, the most frequently in the neck and in the low back. Those are the two motion segments to the spine where we have the most motion, and that is probably what tends to generate some of the disc disease problems that we see. In the past, we used to think that degenerative disc disease was environmental, that you had to work on the dock or be a truck driver to have disc degeneration in your low back or your neck. Now we've taken the stance that it's probably more genetically driven, so it's probably more the hand you're dealt in regard to disc degeneration. But either way, once you're diagnosed with it, the treatment really tends to focus on non-operative treatment initially. So by that I mean things like exercise programs, brace support, medications, sometimes injections, which kind of walks the line between non-operative and operative treatment. So there are alternatives for treating it non-operatively. On the flip side, the surgical treatment tends to be fusion surgery, and that tends to be both anterior and posterior fusion surgery. So fusion surgery that involves removal of the disc from the front of the spine, followed by some stabilization procedure in the back. Now, we can do both front and back surgeries or anterior and posterior surgeries all from the back, but I think that becomes a little bit less rewarding in regard to degenerative disc treatment.